Position for a second set of questions.
Mr. Speaker, the repeated warnings this government received about the crisis in Alberta's NICUs culminated when doctors wrote directly to the minister warning of staffing shortages and the health and safety risks facing our tiniest patients. A day later, the minister rejected their expert opinion, relying instead on a politically appointed bureaucrat who claims everything's just fine. To the Premier, will she apologize for her minister's failure to accept the accuracy of the warnings coming from the frontline physicians who are the experts who are trying to prevent this crisis?
The Honourable the Premier has the call.
Thank you, Mr. Speaker. That's not an accurate depiction of what occurred. What happened when we received the letter in February is that the minister immediately directed her department and AHS to look into it. An ADM did say that they were very well aware of the concerns and they were working on identifying a solution. I should just mention for the record that as of April 18th, there are 17 NICU beds available in Edmonton Zone, 27 in Calgary Zone, 6 in Red Deer, 13 in South Zone, and 5 in Grand Prairie. We are going to be able to take care of every child who needs it.
The Honourable Leader of the Opposition.
Mr. Speaker, both the Premier and the Minister need to admit that they know less about the front lines of healthcare than the people who work on the front lines of healthcare. Meanwhile, even as the Minister and the Premier has been claiming there are enough beds, they're ignoring that there are not enough staff to provide the quality of care that each tiny little bed occupant requires. The first step to solving a problem is admitting you have one. To the Premier, this is an emergency. When will she start treating it as such?
The Honourable the Premier.
Thank you, Mr. Speaker. I recognize there was an emergency the moment I got elected, which is why we began the process of disaggregating Alberta Health Services. Alberta Health Services should be focused on delivering the very best hospital care. What we've discovered is that there's over 1,500 patients who are in those acute care beds at any given time who should be in alternative levels of care. If we can make sure that we have those beds free, then it means that we will have the staff available for what they should be doing, which is the acute care, the emergent care, the NICU care, the surgical care, and that's what we're focused on, Mr. Speaker.
The Honourable Leader of the Opposition.
Well, actually, right after she got elected, she cancelled the South Edmonton Hospital and 20 extra NICU beds. Now, when it comes to Alberta's NICUs, I trust the word of the assistant head nurse for the NICU at the Misericordia over that of the Premier. Today, in addition to calling out the UCP decision to ditch the South Edmonton Hospital, Michelle Guerin said, quote, "The hospitals have physical bed space, but we just don't have enough nurse positions or nurses to take care of them." So, to the Premier, when will she start taking this issue seriously and dealing with the incredible staff crisis that her policies have created?
The Honourable the Premier.
Thank you, Mr. Speaker. I'll explain to the member opposite how this is going to work. 1,500 patients who should be in alternative levels of care are going to be moved to continuing care, assisted living, home care, mental health, addiction treatment, and then we will have 1,500 additional acute care beds that are going to be available to have the staff support patients who are there for emergent purposes, for surgical purposes. This is part of the refocusing of Alberta Health Services. It's absolutely essential so that we always have enough high-qualified staff to take care of all patients.
The Honourable Member for Calgary.
Mr. Speaker, the failure of this government to properly fund our kids' classrooms was highlighted again this week. The UCP's failed funding formula has left Edmonton Public up to $18 million short. Put another way, that's over 4,000 students in that one school board that the province isn't funding. So to the Premier, will she commit finally to closing this funding gap and making sure that all of our kids, no matter where they live in this province, have a fully funded education?
Yes. Well, the Premier.
Mr. Speaker, when the members opposite were in government, we had successive quarters of outmigration, meaning lower and lower enrollments in schools, and we had to bring through a stabilization formula so that as boards saw declining enrollment, they weren't disadvantaged. Now, we've turned things around. 200,000 people came here last year, many of them families with children. So I've asked our education minister to make sure that we are funding education appropriately. We are now funding at a level of $9.3 billion a year. And as we identify additional needs, we will work on making sure that we provide those supports.
The Honourable Leader of the Opposition.
Well, you know, Mr. Mr. Speaker, here's the problem. The fact is, after years and years of funding cuts to our public education system, the children of this province receive less per capita funding than any other province in the country. Not only that, even with the so-called bumps to the funding that the Premier refers to, we are still receiving less funding per capita than anywhere else in the country. So once again, instead of allowing 4,000 students in Edmonton to go to school without any extra funding, why won't the Premier fix the problem her government has created?
The Honourable Premier.
Mr. Speaker, I think that's accurate. I think we have to recall we had 2 very difficult years in this province in the COVID years. And in fact, the formula worked as it was intended, and school boards got more than they would have under the old funding formula. So we are now in a situation where we're seeing an increase in growth, and the minister went to Treasury Board, and over the next 3 years, he secured funding of additional $1.2 billion to hire teachers and classroom support staff. That funding is expected to support hiring more than 3,100 teachers, EAs, and educational staff. We've also committed more than $1.5 billion to support specialized learning needs.
The Honourable Leader of the Opposition.
Well, you know, Mr. Speaker, with all due respect, the Premier's efforts to dine out on the recent moderate increases to funding is a little bit like someone who, you know, tears down a house and then a week later shows up with a tent expecting thanks. The reality is that we have the lowest per capita funding in the country. We did under the UCP starting in 2019, and we still do. And right now in Edmonton, there are over 4,000 kids who are not funded because their funding formula is broken and is not doing what needs to be done. Why won't she fix it?
Point of order is noted at 154. The Honourable Premier.
Thank you, Mr. Speaker. We do recognize that we needed to have an increase in spending to support enrollment growth. Education reached an all-time high spending of $9.3 billion, a 4.4% increase, which is $393 million over the last year. We realize we have to do both. We have to make sure we're supporting the growing school jurisdictions, which is why we're investing $1.2 billion to hire additional teachers and $1.5 billion to support specialized learning needs, including classroom complexity and the PUF program, as well as supporting those school jurisdictions that are in declining enrollment.
The Honourable Leader of the Opposition.